Continuing with Objective 4, now we're going to define, pronounce, and spell surgical and diagnostic terms related to obstetrics. And there's only a couple of them. So these are the ones built from word parts. First we have amniotomy, incision into the amnion, rupture of the fetal membrane to induce labor. A special hook is generally used to make the incision. And then we have an episiotomy, incision into the vulva or perineum, sometimes performed during delivery to prevent a traumatic tear of the vulva. Now we have obstetric diagnostic terms built from word parts. First we have a pelvic sonography, pertaining to the pelvis, the process of recording sound. And then amniocentesis, surgical puncture to aspirate amniotic fluid. The needle is inserted through the abdominal and uterine walls using ultrasound to guide the needle. It is a prenatal test in which the fluid is used for the assessment of fetal health and maturity to aid in diagnosing fetal abnormalities. And of course they would use an amnioscope, which is the actual instrument, and then amnioscopy is the process of visual examination. Since that was so short, let's go to Objective 5, and I apologize, here is a picture of that. They are using ultrasound right here to guide this needle to make sure they're not hitting the fetus. So now let's continue with Objective 5. Define, pronounce, and spell complementary terms related to obstetrics and neonatology. First, we'll start with the ones that are built from word parts. Amniochorial, pertaining to the amnion and chorion. Amniorrhea, discharge or escape of amniotic fluid. Amniorexis, rupture of the amnion. Antepartum, before childbirth. This is referring to the mother. Embryogenic, producing an embryo. Embryoid, resembling an embryo. Fetal, pertaining to the fetus. Gravida, pregnant woman, a woman who is or has been pregnant regardless of how many pregnancy outcomes. Gravidopuerperal, pertaining to pregnancy and childbirth from delivery until reproductive organs return to normal, which is usually 6 weeks. Intrapartum, within or during labor and childbirth. Lactic, pertaining to milk. Lactogenic, producing milk by stimulation. Lactorrhea, spontaneous discharge of milk. Multigravida, many pregnancies, a woman who has been pregnant 2 or more times. Mulnipara, many births, a woman who has given birth to 2 or more viable offspring, meaning live babies. Natal, pertaining to birth. Neonate, new birth, an infant from birth to 4 weeks of age. Neonatologist, physician who studies and treats disorders of the newborn. Neonatology, study of the newborn, branch of medicine that deals with diagnosis and treatment of disorders in newborns. Nulla gravida, no pregnancies, a woman who has never been pregnant. Nullipara, no births, a woman who has not given birth to a viable offspring. Para, birth, a woman who has given birth to an offspring after the point of viability, which is 20 weeks, whether the fetus is alive or stillborn. Postnatal, pertaining to after birth, referencing the newborn now. Postpartum, after childbirth, referencing the mother. Prenatal, pertaining to before birth, referencing the newborn. Primogravida, first pregnancy, a woman in her first pregnancy. Primipria, first birth, a woman who has given birth to an offspring after the point of viability, 20 weeks. Pseudocyesis, a false pregnancy, a woman who believes she is pregnant. This may be a psychological condition or related to underlying pathology such as a uterine tumor. Purpura, childbirth, a woman who has just given birth. Purpural, pertaining to immediately after childbirth. Teratogen, any agent producing malformations in the developing embryo. Teratogenic, producing malformations in the developing embryo. Teratology, study of malformations. So then we have complementary terms not from word parts. APGAR score, system of rapid neonatal assessment at 1 minute and 5 minutes after birth. Breech presentation, birth position in which the buttocks, feet, or knees emerge first. Cephalic presentation, birth position in which any part of the head emerges first. It is the most common presentation, and of course this is what the slide is showing. And so this slide is showing you the breech presentation, birth position in which the buttocks, feet, or knees emerge first. The neonate is referred to as a breech baby. Now look at the spelling. This breech is B-R-E-E-C-H. If it's spelled B-R-E-A-C-H, this refers to failing to observe a law, conduct, or agreement, such as a breach in contract. So just pay attention to that. Continuing, cesarean section. Birth of a fetus through an incision in the mother's abdomen or uterus, I apologize. It could also be spelled C-A-E-S-A-R-E-A-N. Colostrum. Thin milky fluid secreted by the breast during pregnancy and during the first days after birth before lactation begins. Congenital anomaly, abnormality present at birth, often discovered before birth by sonography and or amniocentesis. In vitro fertilization, method of fertilizing human ova outside the body and placing the zygote into the uterus, used when infertility is present. Infertility management techniques that artificially combine both the ova and the sperm are called assisted reproductive technology. Lactation, secretion of milk. Lochia, vaginal discharge after childbirth. Meconium, first stool of the newborn, and it's a greenish-black color. Midwife, individual who practice midwifery, practice of assisting in childbirth. Obstetrician, physician who specializes in obstetrics. Obstetrics, medical specialty dealing with pregnancy, childbirth, and puerperium. Parturition, act of giving birth. Premature infant, infant born before completing 37 weeks of gestation, also called preterm infant. Puerperium, period of delivery until the reproductive organs return to normal, about 6 weeks. Quickening, first feeling of movement of the fetus in utero by the pregnant woman. It usually occurs between 16 and 20 weeks of gestation. And stillborn, born dead, death of a fetus after 20 weeks of pregnancy. And so here's just a quick question. Antepartum and postpartum refer to birth or to the mother. And again, you can always go back to your chapter, but it's going to be B. This is always referring to the mother. And that will end this recording.